Hello and welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us. Glad that you're here. Going to have a conversation with Dr. Jennifer Popovsky this morning. You know, from state fairs to Labor Day picnics, beach trips, cookouts, summer means a lot more time in the sun, but overexposure to the sun can cause painful sunburn, and worse yet, it could even lead to skin cancer, with men being more likely to be diagnosed than women. Now, here to explain to all of us, especially us guys, what we need to know about staying safe in the sun is, as I said, Dr. Jennifer Popovsky, dermatologist. Thank you for joining us today, Doctor.
Oh, you're welcome. It's my pleasure.
So what are some of the ways that we can protect ourselves from the sun, especially now that it's summertime and we're all wanting to be cooking out and swimming and things of that nature?
Well, the best way to protect your skin is to stay covered up. And so a hat and sunglasses is the most important thing, actually even better than sunscreen for your face. A hat with a brim, like a big farmer's hat, which gives you coverage over your ears and the back of your neck as well, and sunglasses. And you should wear good UV protective eyewear, not necessarily the cheap $5 sunglasses from the drugstore. You should really invest in a good pair of sunglasses that'll protect your eyes and the skin around your eyes as well, where you can't put your sunscreen.
You know, a lot of folks walk around with an umbrella. Are there special types of umbrellas that are made especially for sun protection as opposed to, rain and weather?
It's a really interesting question. No, actually, just your regular old umbrella that you use for rainy days is perfect to take with you. If you're going to the kids' soccer game, set up your sport chair and then sit with your umbrella. A lot of those chairs now will have a piece that you can flip up and get you out of the sun. So that's a great investment to make if you're a parent with kids and you're out at baseball and soccer all summer. So really trying to stay under an umbrella and in this shade. If it's a 90-degree day and you're out on a boat fishing, try to make sure your boat has some coverage. There's a huge correlation between golf and skin cancer, fishing and skin cancer, all these things we like to do outside to keep us young and keep us healthy and keep us active. So if you can't have your clothes on, you're at the beach or you're bike riding and it's 90 degrees and you can't be layered up, then you've got to get on your sunscreen.
So you don't have sunscreen. There's a little bit of shade. How long can you stay in the sun exposed without any protection before you have to seek shelter of the shade?
So that's different for every person. Mm-hmm. So there's a different amount of time that everyone will get a burn depending on their skin type. A lot of my patients ask me, is there a genetic link to skin cancer? Well, skin cancer does sometimes run in the family, especially with melanoma, which is the deadliest form of skin cancer. If you've got a parent or a sibling who's had a melanoma, your risk really does go up. And melanoma now occurs in 1 out of 60 people, so it's already a pretty common cancer. So again, if you have a family member who's had a melanoma, your risk is higher. So there is that genetic link. But more so what we inherit from our parents is we inherit a skin type. So your question was, how long can you be in the sun? Well, any of us, regardless of our skin type, we all get damaged if we're in the sun. And what most people don't understand is that tanning is just as bad for us as burning. So I think we all know now that you shouldn't get a blistering sunburn, and we prevent that in our children especially. We spray them with the sunscreen so they won't burn. But nobody seems to really be educated enough about the dangers of tanning. And so what you inherit is a skin type that allows you to be in the sun for a particular period of time until you start to tan or until you start to burn. And so the analogy I like to use is it's like a glass. So everybody's born with a certain size glass. If you're a redhead or you're a towhead blonde, you're blonde-haired and blue-eyed and really fair skin, Northern European descent, maybe your glass is a shot glass or a little cocktail glass. If you're olive skin, so you're Italian, you're Greek, you're Persian, and you've got more natural pigment in your skin, maybe your glass is a big, Pilsner beer mug. But ultimately, if you're out in the sun for too long, you'll fill that glass up. And once your glass is full of sunshine and it starts spilling over, every additional drop of sun you get becomes a precancer or ultimately a skin cancer. So it's a lifetime of sun damage. And the fairer skinned you are, the sooner and the earlier in your life you'll start to get skin cancers.
Okay. So you mentioned melanoma being the most deadly type of skin cancer. What are a few of the other types of skin cancer that maybe it's all serious, of course, but maybe not as deadly as melanoma?
Correct. So there's three main types of skin cancer, and the most common kind of skin cancer that we're seeing now is basal cell skin cancer. And luckily, basal cell skin cancers are usually not life-threatening. So 1 out of every 4 people now gets a basal cell skin cancer. We're diagnosing more than 1 million new skin cancers a year in this country. And people are getting their basal cells at younger and younger ages. So I see people every day in my practice who are in their 40s who are already getting their first skin cancer. And that's really significant because that means we're living longer. So we're living into our 80s and our 90s, which means now you've got an extra 40 years of getting more skin cancer. So basal cell is the number one problem that we see. The second most common form of skin cancer is squamous cell skin cancer. Squamous cell skin cancers tend to occur in people who are fairer skinned and also people who get more chronically exposed, so people who have outdoor occupations. So that would be your farmers, your guys who work construction, people who work in home building and are up on roofs, even your postal carrier who's out delivering your mail all year long getting sun exposure, they get squamous cell skin cancers. And then, of course, you have melanoma, which is the deadliest form of skin cancer, which now occurs in 1 in 60 people.
What are some of the signs? I mean, people talk about moles that show up, little blotches on the skin that they don't think anything about, and then 7 years later, they find out that they have a type of skin cancer.
Sure. So the most common forms of skin cancer, which are the non-melanoma skin cancers, are not going to be moles, and they're not going to be brown or black spots. They actually typically look like red spots. So if a basal cell is on the body, a lot of times it just looks like a little scaly patch, maybe looks a little red, gets a little rough feeling. And the warning sign of skin cancer is if you pick at it, they're kind of soft, and so they'll actually start to bleed. So if you have a spot that every time you wash your face, for example, and you rub it with your washcloth, it kind of gets a little bit of pinpoint bleeding, or it seems like it has a little scab and then it wants to heal up, but then the scab is back in the same spot again, that's probably a basal cell skin cancer. Squamous cells can look kind of similar, but they grow a little faster, and they'll form a bump a little bit more quickly. And then, of course, your melanoma skin cancers are the ones that are the darker colored skin cancers. So they're spots that are flat on the skin like a stain. They don't have to be a bump. In fact, they're usually not a bump. So if you run your hand over them, you can't feel them, but they have irregular borders. So they're not a perfect circle or a perfect oval. They look a little jagged at the edges. The color may not be all one color. They're what I like to call they're smudgy. So when you look at them, you can't quite tell where they start and stop. And then they grow and they change slowly over time. So if you've got a spot that's dark, that's getting bigger, or that has multiple colors in it, or kind of jagged at the edges, that's a spot that you should have looked at pretty quickly.
Mm-hmm. So would a biopsy would be appropriate?
Yes, very much. So the diagnosis of skin cancer is made by seeing a dermatologist and having a biopsy taken, which is a very simple, very minor procedure. And then once we have a diagnosis of skin cancer, there's varying treatment options depending on where your skin cancer is and the type of skin cancer you have, with surgery being the mainstay of treatment. But if you're not a candidate for surgery, or your cancer is too advanced, or there's other health issues where you can't tolerate a surgery for skin cancer, some cancers can be treated with radiation therapy. And then for other types of skin cancers, there are drugs that can be used. As an example, for basal cell, which again is, occurring in 1 out of 4 people. Some people present and already have very locally advanced skin cancers, or skin cancers that are, inoperable. And for those people, we have a medication called Araveg, but that has to be decided at a doctor's visit by your doctor.
At the outset, I mentioned that men are more likely to be diagnosed with some type of skin cancer than women. In my experience and in my lifetime, I have seen many, many women tanning, in both tanning booths and on the beach, outside. Is it because a lot of men have these outdoor occupations, as you mentioned? Is that why men are more likely, or is it some other underlying factor that makes men more susceptible?
No, it's not that men are more likely to get a skin cancer. Again, 1 out of every 4 people is getting a skin cancer. So we're all getting these, but men don't pay attention to their skin like women do. You know, women have all the cosmetic stuff and the makeup, and I think women are a little bit more vigilant about their skin, potentially a little bit more diligent about wearing sunscreen because of its anti-aging effect. You know, that the sun makes us age too. It doesn't just give us skin cancer. So I think men don't pay as much attention to their skin and are not nearly as likely to go to a doctor for a problem as women statistically. So if men do get a skin cancer, I think they get diagnosed a little later, which means their cancer might be a little bit more advanced or be more of a problem. But absolutely, women are getting skin cancer too.
Where can our listeners go online and get some more information about protection from the sun and the potential for skin cancer?
So there are really good advocacy websites. You should check out skincancer.org or the American Cancer Society's website, which is cancer.org.
Dr. Popovsky, thank you so much for joining us here on Health Professional Radio.
Thank you.
You've been listening to Health Professional Radio.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.